Welcome back to the CW30 News at 7 p.m. Earlier, we spoke to an actual COVID-19 long hauler about her personal experience after recovering from the virus. Joining us now via Zoom is Dr. Dixie Harris, critical care physician with Intermountain Healthcare. Dr. Harris, I know you had a full day seeing patients. Thank you so much for making time for us tonight. How are you?
Great.
Dr. Harris, how would you define what a COVID-19 long hauler is?
So currently there's no standard definition, but what we're using here at Intermountain Healthcare is the definition that was given in the British Medical Journal article that discussed this and gave protocols and guidelines for it. And so the definition is acute COVID, post-acute COVID is symptoms after 3 weeks, and chronic COVID is symptoms lasting longer than 3 months. So that's kind of our current definitions.
What kind of long-term symptoms are some of these long haulers experiencing after recovering from COVID?
Right. So currently, when I see a patient that's been referred to me, and most of the patients referred to me because I'm a pulmonologist, are having ongoing lung symptoms, and some of them are having chest pain, palpitations, heart racing. But I ask a slew of symptoms, and I have a bank of 20 symptoms I ask every patient. The predominant symptom I'm seeing is fatigue, and then a milieu of other symptoms. And one of the symptoms that I'm really finding, and I actually have to ask about and really have to tease in, is about patients' memory. And that to me is one of the more concerning things, because when I really ask about the questions, they really find, yes, I do have decreased memory. It is coming back, but my memory is diminished. And that's especially important for patients who are trying to get back to work.
I can see how that could be a really big concern. It's been more than 6 weeks since we last interviewed you about the COVID-19 long haulers. Is there any new information or data regarding this group of patients that you can share?
Oh yeah, so the data is coming out slowly over time, but part of it is just we're just still learning about these patients. It's pretty clear 10+% of patients that get COVID will end up having long-term symptoms, and it can hit all ages. A couple of things that we are learning about, we're learning about the long-term. We can actually see effects on the MRI scans of the brains, of the long-term effects 3 months plus after. So we do know it's affecting our brains and affecting all over the body. And one thing I will say is the patients that I'm seeing are slowly getting better. I haven't seen anybody plateau yet, but it is taking a long time for the patients to get better.
And I think that's a sobering reason why we really need to take this virus seriously. I know you guys, as our healthcare leaders, are still working very hard to understand more about COVID-19. What are some options that are available for long haulers right now who don't know where to turn?
So what we're doing, the approach we're doing is because one clinic won't answer 10% of all patients have had chronic symptoms for COVID, right? So what we're doing is approach of starting at primary care using this British model, educating. I've given so many talks to primary care, to all kinds of providers. We're giving guidelines, we're developing guidelines. And so I say, start with the primary care and continue to ask questions, talk to the primary care. If they haven't heard about it, they can certainly contact me. I'm seeing patients, several of my colleagues are focused on seeing patients, and we're looking at them for either the long-term pulmonary effects, certainly the myocarditis is one of the things we're worried about, the long-term neurologic effects, and really kind of coming at it from all different angles, but really starting with primary care and then expanding out the knowledge and the support. The things I really want to be addressed are if somebody's having anxiety that needs to be treated, PTSD, and those are more seen in the patients that have been in the ICUs. And then also some depression and kind of helping give them guidance. The one thing that has started that is new is the University of Utah Nursing School has started a COVID-19 grief support group. And the phone number for that, I'll give it to you, is 801-585-9522. And they've had their first meeting last week. This is funded through the Department of Health.
Doc, we have about 30 seconds left. One last question for you. We still have a number of Utahns, unfortunately, who don't take COVID-19 seriously. Some who think that they're going to be fine once they're recovered. What would you say to members of the public about the impact that this illness can have in the long run?
So this virus is very cruel. It can hit your body in all different ways. I've seen patients with headaches for months. I've seen patients with fatigue for months. And it's not a guarantee that you can skate through this freely. There's no rhyme or reason to who has which long-term symptom that we can find right now. Initially, we all thought, oh, let's just get it and get it over with. I do not want this virus because I don't want to take the chances of being one of these long haulers that are suffering, frankly.
Dr. Dixie Harris, critical care physician at Intermountain Healthcare, thank you so much for joining us tonight.
Thank you so much.